So I introduced my NPO activities. I created a picture book for hygiene education because in Bangladesh, 200,000 children die from foodborne diseases every year. This number is, I think, is very big, but international organization cannot estimate these great numbers. So this cause is coming from is incomplete survey of medical institutions and lack of access to medical service for infected children. It's very serious problem. So if children know the cause of foodborne disease, so child victim can be reduced. So I make the picture book to for the children to understand the how foodborne disease occurs. And this picture is translated by Dr. Bari and Mr. Hussain. So I thank them. So our program is very difficult to distribute to picture books to all over Bangladesh. So as you know, remote area is very huge. So transport is very difficult. So I needed the big project powers for administration powers and the JICA powers and other NGO powers. We need everything. So now next step is considered. This next step, it means science experiment, hygiene education science experiment. Children understand how to prevent the foodborne disease by reading picture book. But this knowledge is known in brains. It's not practical. So more deep understanding is needed. So child experiments the fact of which is perishable or non-perishable food. This difference is understood by children. Children avoid the risk of foodborne disease. For example, the food vendors and the food companies management is very poor. It means is hygiene management is very poor among the food vendor and the food companies. So this reality is not known by children. Children must know this risk from the food vendor and the food companies. So we start this science experiment from Dhaka University. Dr. Bari organized this science experiments. So I make the guidebook for science experiments. And after that, Dr. Bari modifies the context adapted to the Bangladeshi lifestyle. And unfortunately, I get the 5 microscope donated from Japanese companies. So using by microscopes, children can observe the invisible bacteria and other creatures in drinking food or the different foods. So after reading a picture book, children can imagine if this drinking drink water and the food heated by boiling or steaming or baking. So this food and drink become safe, drinkable. So these expenses very important to children to protect the foodborne diseases. Do you understand my English, sir? So first I need the reading, next real experiments. So children understand the foodborne disease risk every day. So children victim can be reduced. So we need your help and the power. So I hope your coordinations, especially JICA. Thank you very much.